going to contribute. She is also expecting contributions from us. So to give a brief introduction about Dr. Ramya, see, Dr. Ramya is basically from Tamil Nadu. She did her MBBS in Stanley Medical College, Chennai, and post her MBBS, she was working in Chennai, and for some period of time, she has worked in CMC Bangalore as well. At the moment, she is working as a senior resident in ECHO project in Geriatric unit in Department of Psychiatry in NIMHANS. She is a very experienced doctor, and the topic chosen for today is social technologies and elderly. But Dr. I will request Doctor to concentrate on what are all the social technologies, new technologies that have come, and what are all the plus points in that, and how it can really help the senior citizens. So in today's context, without gadgets, without channels, and without apps, people cannot live, whether he's a junior or a senior. This is the situation. In that, but there are some challenges in using that. See, what are all the challenges in using them, and how to overcome those challenges. So this is the area on which Doctor will be concentrating on that. I do not like to stand between you and Doctor for a long time. I now request Doctor to take the chair and hold on to the mic. Thank you very much. Thanks, Doctor. You can go ahead.
Thank you, sir. Thank you for the warm welcome. And I'm happy to be back on the my class. Not so much of a class, I would say. And I'm happy to see Jamunathan, sir. I see also Congrats, sir. I may not remember, don't mind that, but I'm, it's nice to be back. So like sir mentioned, it's a very wide and sort of a vague term when we just look at the topic, social technologies and elderly or, so social technology, again, it's nothing but an umbrella term. Any, let's say, online platform or gadgets or any app you connected with people, right? Whether it is for a productive task, or is it for a recreation or entertainment, or the list. So I just formulated today's talk like, where are we in that? How we progressed in the last 1 to 2 decades, and let's say what are all the pros and cons of these social platforms or apps with respect to our beloved senior citizens, right? So here the line is going to be more bi-directional, more from you, I understand. So moving forward, and this particular pick is from one of my favorite movies. It's called The Intern. I think it's even available in Netflix or an online platform. So it's a very nice and a cute film where this elderly gentleman who has worked for quite some time, 30 to 35 years, he's been on working in an office and as a phone book manufacturing unit, and he retires and he's sort of bored and he wants something to look forward to. So he ends up taking up an internship in one of an organization which involves it's online shopping related company, let's say. So on the day one, he starts, the left picture shows his briefcase where he comes with his laptop, his clock, and his pen and paper, phone book, let's say. And next to him is another intern or an employee who just arranges whatever the gadgets he's using. He has a fancy laptop and pen drive and stuff like that. And let's say as the movie goes, he's getting used to it, and the people he makes friends and they're very nice to him, and they sort of facilitate or mitigate him to sort of get comfortable with the current social platforms, and which he also is excited to learn, and he actually uses a lot of it. So yeah, so just this again is just to basically understand. So the Helpage India again did a nationwide survey in 2018, and the topic on elderly abuse, and one of the chapter involves sort of the impact of technology in the elderly. So overall, these are some of the results that we had. So at the national levels, in general, the internet users among the elderly population was quite low, less than 5%, let's say. And it was seen that now this study involved almost 5,000 people, and who were 60 and above. So again, of the elderly, elders living with spouse only had a relatively high internet usage. And gender-wise, if you see, there was a difference wherein male elderly users were slightly higher, like 5% as compared to the female elderly. Now, looking into where all it helped them, what were all the most common purposes or intention for them to use it. So the majority had reported that it was mainly used to connect with their kith and kin, like their family members, right? More so who were staying away, like abroad or something, or even who are physically around. The second common reason or purpose was to connect with their friends. So now this again could be their college friends, or just their friends around in their apartment, their little groups, whatever it is. And third common reason was to learn new things. So like one Shamanathan sir mentioned, like this YouTube, there are a lot of YouTube videos. So starting from cooking to exercise to you name it, and it's there. So the third common reason was to learn new things. Now, just an overview of what are all the usual perceived pros or the advantages. So again, it starts with, like we saw the reason, many things, like out of 3, 2 were to connect with family and friends. So let's say in the last 2 years, again, it has made even more sense, because it was because of these platforms that we were able to connect with our extended family members during the COVID-19 crisis. Now, this is again not specific to the senior citizens, it applies to all of us. And in some sense, to understand the younger generation better, now this again is open for discussion. And again, the community groups or getting the news feeds then and there and sort of updates. And some other pros would be the having a health related. So this online lab services, and now home sampling has been going on for so many years, which has made life little easier in that sense. So you don't have to mobilize unless otherwise it's extremely warranted. Saves up a lot of physical exhaustion and probably money as well. And some of the transport apps or the shopping apps, let's say even for grocery or other shopping or the food delivery services, and online banking services, again, it in itself has a lot of pros and cons, I would say. I think Sir can contribute more in this. And nonetheless, online banking services had made a lot of processes easier, but how much it is benefiting our senior citizens, now that is open for question. Again, let's say for entertainment or recreation purposes, you have your ebooks or your Alexa. So these are some of the things that it is generally perceived, or which are very obvious reasons or the advantages in general that we see. Now, moving on to the cons, or what are all the usual challenges or disadvantages. Now, it starts with, again, the visual and hearing deficits, or the deficits that happens mildly with respect to age, the sensory neural hearing loss. It need not amount up to a hard of hearing or a loss, but let's say even a minor impairment. Now that could make it much more challenging, despite the intention or wanting to use these apps. It does make it a little difficult. Now coming to the cognitive difficulties, again, age-related, multitasking is slightly difficult than our midlife or early life, and our attention span, again, both are interlinked. Multitasking and your attention span, your sustained attention, can come down with age. That might hinder our ability to go ahead and efficiently use these apps or gadgets. Now, sometimes, again, it depends on our, in general, our educational or socio-cultural background, or the individual person's notion about these technologies and their basic need, whether they need it or not in their day-to-day life. And when it is sort of, there is a gross mismatch from that background and what they're expected to cope up with. So in such case, again, in this fast-paced world with so many technologies, they might feel a bit overwhelmed, and in turn might, make them feel a bit isolated, right? And again, one of the other things is this security threat or these spam calls. Like even this is like, we get a lot of spam messages or text, like fake calls or fake messages to click the link, or like you have received so much of money in your account. Now, this takes time for us to, not reflexively go ahead and click that. Now, a person who has recently started using a phone or online banking services may not be able to quickly differentiate between what is a legitimate message and what is a spam call. Now, unless otherwise there is proper and consistent guidance from their family members, or even, let's say, their grandchildren. Now, this again many times is targeted towards the senior citizens, or because they are quite vulnerable, right? And the other thing, which is sort of so in a very, in a very social aspect, if you look at, many felt, even in the same study, many felt the extreme attention given to phones or computers, they felt very as being disrespectful towards the elderly. And now this in turn can cause some subtle or overt, interpersonal difficulties or a friction that might happen. And again, in turn, they might end up feeling even more socially isolated, and the feeling of loneliness can set in. And again, related to that, because of this extreme attention, the amount of quality time spent with our kith and kin by the younger generation is going to come down gradually, right? Yeah. So just to sort of summarize, again, elderly in general are understood to be quite vulnerable population, like, they are extremes, like as a child or our elderly population are quite vulnerable in their own ways for various reasons and factors. Again, whatever technology or the platforms that are used or being thought of has to be sensitive to their needs and challenges. Now, practically how much it has patched up, we are not very sure. Now, again, so balance is key. So based on their needs and how much it is practically applicable, how much it is actually benefiting them, or, making their quality of life better, and how much, what are all the detrimental effects, there always has to be a sort of risk-benefit balance that has to happen consistently, and those who are using and the people around them, let's say friends or family, has to be quite mindful about it. So yeah, so this is pretty much what I wanted to talk about. One other point would be, yeah, so the same study, after the study, they came up with a program, or more so, which was called Disconnect to Connect. So lesser and less in the context of less quality time with the family and friends. So this initiative was to insist or imply less screen time and sort of more in-person communication. And it also had some digital literacy workshops wherein the senior citizens were guided, or or taught, or sort of trained in using these apps and gadgets based on their requirements. Yeah. So now I would want to open for discussion. Like, you can share your experience in general. Like in the last 2 decades, there has been sort of a massive change that has happened in how much, like Jamanathan sir mentioned, these things have become an integral part of our life and routine now. It is not some new thing that has come up, but how much, where it has taken us in a good way or a bad way. You can share your thoughts and inputs.
So thank you, Doctor. I think you have very succinctly pointed out what are all the challenges that are being faced by the senior citizens for using the app. While at the same time admitting that, I mean, we have reached today a situation where perhaps life will be difficult without these apps. Life will be difficult without these gadgets. Can we think of a house without the, refrigerator? See, refrigerator is also this thing. And as you rightly pointed out, the first thing, in our days, what we have been having was only a suitcase, briefcase with this calculator, with all the papers, and the best equipment that we possessed was a telephone. That even possessing a telephone at home was considered to be a big luxury.
Right, very true.
Yeah, from that situation, today you have come to a situation where you are unable to find a person who doesn't own a mobile phone. So this is from one end of the spectrum to the other end of the spectrum we have come, Doctor. So in that, one more point I wanted to emphasize is that this COVID would not have been sailed through COVID, but for this technology and evaluation, but for the Wi-Fi. And if the same survey is whatever survey that has been conducted in 2018, if it is repeated in 2023, I'm sure, Doctor, there will be lots of increase in the usage of Wi-Fi, even amongst the senior citizens. And today, for a moment, I will say that today more ladies are using it than the gents. I'm unable to find a lady who is walking on the road without using the mobile, without talking on the mobile phone. So that kind of situation is now come. Even at home, I think for preparing something new, I think immediately they will refer to the YouTube cooking page, find out what is, and then cook that. This is going to be my dinner for night. So this is what I have seen in the YouTube. So this kind of a technological change has come, Doctor. Yes, I also agree it has taken up lots of challenges. One specific point you were talking about banking. See, I think I am slightly qualified to talk about that banking.
Yes, you are.
And the challenges, that people might face in doing online banking. See, my simple request to people is that please take the help of a known person before starting into online banking. See, even 2 days back, I was at a seminar on this online banking only, on online, how to use online apps. So this online banking, the banks have given lots of safeguards. But therefore, and you try to do only transactions that are needed. Please let us be very clear about one thing. Nobody is going to call you on telephone from the bank. and say that you are a great person, you click this. Nobody is going to do that. When you go to the bank, what is the normal experience? We find all the people to be very busy and looking at their computer. They don't look at your face itself. In such a situation, do you think that somebody from the bank is going to call you and say that ask you how are you? So it is impossible. Therefore, let us not be deluded into that. And heavens are not going to fall if you are not going to do an unnecessary transaction. Even somebody calls you and says, okay, sir, I am busy right now. I'll call you later. That way, people can escape. But without these apps, the doctor, I tell you, independent living by the senior citizen is going to become very difficult. In today's context, the next generation people are very busy in their own avocation. Therefore, there is no time for them. So there is no time. They are not able to spend any quality time with their parents. And this disconnect has already happened. However much we are going to talk about disconnect to connect, this has already happened. Therefore, I think in that context, for an independent living, people have to use these technologies. People have to use this irrespective of their age. Only thing is, they can guard themselves by taking proper training before using that. Therefore, I think even nowadays, the frauds have also come down heavily, doctor. Yes, once upon a time, it was quite high. But slowly, gradually, people are also understanding things. Therefore, we are in for a good situation, doctor. With that, this thing, I will now request all other participants, whoever wish to contribute in any point on that, especially doctor likes to know from you as senior citizen. Therefore, she can also, accordingly, give a response to that. Therefore, I request people to talk. Thank you.
Thank you, sir. So adding on to that, like you said, it's quite reassuring, especially for a person, living by himself or herself, or with just the spouse, and sort of children have all moved away and all busy with their respective lives. So having, being a little handy with this basic apps or gadgets is definitely very reassuring, right? And sort of it also serves as your safety network at times. And like you rightly pointed out, as and when needed, basic thing would be take a brief training and do as minimal as possible with respect to this, sort of very sensitive, such as online transactions, etc. And take assistance whenever needed, and sort of probably delegate some of the major things which you're not very sure of to your children or grandchildren. That would be one way to go about it.
Yes, doctor, you are very correctly put it, doctor. That is the way to go about, because we cannot wish away this. This has come to us. So we need to only, how to use it and continue to live with this. So we cannot wish it away. That is the reality, doctor. Right. So let us live in the reality.
Right.
Very correctly said, Mr. Jamunathan. I actually seek the help of my grandchildren, even for making UPI payments, So the digital outreach has been, digital outreach even to the remotest villages has been the greatest digital revolution these days. But even for elderly people like me, because I am afraid that I may show a failed transaction when we make GPay payments. So I always generally seek the help of my grandchildren to help me to make payments. So that way, because sometimes the pop-up messages also coming in, while going through the messages. So we don't know whether to say accept it or not. So that time I always seek the help of my grandchildren to help me to get out of the situation.
Yes, sir. I think that's an ideal way, or a very sensible way.
Certain pop-up messages are coming very often in my phone. I don't know whether to click it or whether to. So I seek the help of somebody to clear out these unwanted messages. Yes.
Rangota, sir, thanks, sir.
Yes, but you are right, sir.
As a general guideline, what I will say, sir, Sir, don't click any pop-up messages, sir.
Yes, yes. That's
Banks
why.
do not send any pop-up messages at all.
Yes, yes. If it is even unknown messages or unknown people from calls from unknown people, I don't attend.
That's all.
Yes, that is how we can save ourselves from
Exactly.
any malpractice.
Yes, sir.
Anybody who tries to defraud us.
Sir, in fact, sir, as a person from the postal department, you
Yeah.
can say what is the sea change that has happened over a period of time. Mr. Venkata sir was with the postal department for a very long time. He was, I mean, very, very
Of course,
high.
those days there was no this digital outreach was not that much. Actually, we are even now using the cell phone during my career. Because I retired in 1994, you know. So those days we were not using the cell phones or the tablets and all those things. Only now we are using all these things. So of course these days there is so much of digital transactions taking place, which I am not aware of. Probably Jamunathan knows better about this. You are in the bank, isn't it, Mr. Jamunathan?
Yeah, I was.
Yes.
No, but today's contacts are without
Yes.
digital thing, we cannot live.
Yes, yes, you are right.
That's
You can even forget your purse, but you cannot forget your phone.
But many apps which are very good, which has got lots of protection.
Yes.
Safeguard the customers.
Yes.
So
There are good. Yes, you are right. You are perfectly right.
It is like, I mean, like trying to live without the medicine nowadays.
Yes, yes.
And a person
Right. Digital health, even now, there is so much of digital transactions, even for health services. So that's what I learned from newspapers.
Hello, Mr. Jamunan, sir.
Yes, sir.
Can I?
Please, sir. Please go ahead, sir.
Good evening, Dr. Ramya,
Good
Stanley,
evening, sir.
Doctor.
Yes, sir.
Special mention for Stanley.
Thank
Because
you. Yeah.
our children are Stanley people.
Oh, nice. Yeah, we are a big family then. Yes.
Yes. Technology is helpful in some ways, and delays are noticed even though technologies are introduced for the past 20 years in administration. We are conducting Zoom meetings for the past 2 years for senior citizens. It's a plus point. But one more point, we are consulting doctors whenever need, emergency, urgency like that. This is one of the plus point. The another point, today I have seen on Hindu paper, there are 3 lakhs and above vacancies are to be filled up within a year. How long the vacancies, they didn't mention anything. Because from pointsman, from a station master, very, very important person, lower level people are not appointed for a very long time. What is the use of technology to conduct a examination, evaluation, interview, appointment, etc. These things will be completed within a year. Today, the minister is saying. The technology, if they could have used in a positive manner, the vacancy could have been filled as early as possible, because to avoid accidents and timings, more problems in railway we can see. Somebody is speaking. Likewise, public services are online, like that they are announcing, but things are not moving so fast when the applicant has entered his request through online. Again, retapism is happened. They did not get services within the specific period, or at least 1 month, 2 months, 3 months, like that. These are all technologies are not used properly for their for some other reasons we know. Then one thing, as Mr. Jambanathan was telling, bank fraud online like that are happening very, very, very large scale because we could not ascertain the people behind the frauds. Lakhs of crores are being swindled by the big persons, corporate persons. After a long gap, then only it is coming through medias. The lakhs of crores are swindled by a person, and share market fraud like that. What is the use of technologies? Who are monitoring IRDA, Reserve Bank, and many watchdogs are there. But things are not properly used, knowing or unknowingly. The banks are, particularly State Bank, Punjab National Bank, LIC, these things are for the past one month or 1 week in the headlines of the newspaper and medias. How they are not able to utilize the technologies to find out the mismanagement from the upper level to lower level. Our public money is not in the safe of the banks and LIC like that. Private persons are also maintaining insurance company, banks and other things. What is the difference, the laws and the services between private persons and government institutions? Let our senior person, Mr. Jampunathan, can explain how this is for the before 20 years, all are maintained in ledgers. When there was no complaints, either from the customers or from the banks. Very, very smooth. We were seeing the management of bank very, very useful to the public. But nowadays, technology problem is very, very more. Public money are not safe in the custodian. These things, plus and minus are there. Anyway, we could not leave the technology, our mobile, our TV, our laptop. Everything is essential nowadays. As he said, we should not mention gender. Men or women, they are more walking with the mobile phone only. They are not seeing the vehicles, other people opposite side. Nobody is worried about, because they have no time to talk in their home. Many people are using a mobile phone in the office hours, but particularly he's mentioning about women, because women has got more work when entering their home, family circumstances. They are only on the vehicle or the walking. They have to spoke with their parents or relatives. They are having some problems because we have to take this view also. Thank you very much. The others can say their views. Thank you very much, Doctor and Jampunathan, sir.
Thank you, sir. Thank you, sir.
Hello, Doctor. Good evening. Hello,
Yeah,
Mr. Jampunathan.
Good evening, sir.
Good evening.
Chandrasekharan. Yes,
So my
sir.
point,
Hi.
my point is this. Question is this: since you are in the banking sector, then how is the safest way to handle the internet banking?
Sir, I think you have raised a very, very big question, sir. Hello. Am I audible, sir?
You are, sir. Please go ahead. Yeah.
See, you have raised a very, very big question, sir. See, in the sense that, if you can go into the bank's website directly, you see, if it is supposing you are maintaining account with State Bank of India, see, you have got a online, the www.onlinesba.com. See, you will have to first see whether it's a secured site, whether the site is a secured site. If you go and you can, that security is, you can see by means of a lock symbol. If the www, yes, last word will be yes, secured will be there, or a lock symbol will also be there. If you are able to reach that website and do your transactions through that website, probably you are 100% safe, sir. There is no chance of some other person hacking your account or something like that. Number one.
Very good. Very good.
Number one. Number two is that, sir, in today's context, what is happening is all banks have introduced 2 times authentication. First authentication is that first you are entering into your website, you are giving your name and your whatever be the password. After entering that, you will be receiving one OTP in your mobile number, registered mobile number. So use that OTP, then only start transaction. If you are not using that OTP, you will not be able to enter into your website at all, into your account at all. This is the second level of security. And the third level of security also I tell you, sir, supposing you like to transfer some money from your account to another person's account. Then also, once you complete all your credentials and all your transactions, one more OTP is going to come to you on your mobile phone. Only when you type that OTP into that website, your transaction is going to be completed. Therefore, there are 3 levels of security available to you when you are transacting through your through the website of the bank. So try to do almost all the transactions through the website. And the fourth thing is that, like supposing you are buying something online, then in that also, see, each website has got, no seller website has got a direct power to approach your account. They approach the account only through a third party. The third party is always a well-maintained third party who has got his own security platform. In that secured platform only you are going to give your credentials. Therefore, try to do transactions with well-known companies. Let us not go to some new players in the market because we really do not know about them. Therefore, we will try to restrict because our transactions are going to be limited, sir. And if at all we are going to get some benefit, maybe we may get a benefit of 1 to 2% between 2 transactions, between 2 websites. Better we pay 1% more and go to the trusted website rather than saving that 1% and getting into a unknown website and being cheated. Therefore, that is the second stage, sir. Therefore, even when you are going to a shopping, what do? You go to some shop which is well known to you. Supposing you would like to buy some medicines, do you go to any pharmacy? You have got your own pharmacy. Either you go to Apollo Pharmacy or you go to MedPlus or something like that, where you know somebody, where you have transacted very much in the past. Therefore, there is some kind of a trust there for you. So you try to go to the trusted sites. That is what we call in banking. Normally, in trusted sites, you are not cheated. Most of the cheating takes place on untrusted sites only. Therefore, try to do your transaction through trusted sites, sir. And fourth is today's context, UPI. UPI has come, United Payment Interface has come. It is a beautiful thing. Then try to restrict your online transactions also to certain values, sir. Because, see, if you want to invest some 50,000 rupees or 1 lakh in fixed deposit, better go to the bank in person and do that, rather than doing it sitting at home through your mobile phone. So, because you are assured of complete safety there. Therefore, on the other hand, suppose you want to buy something for 200 rupees or 300 rupees, you can do. So that way you can safeguard yourself, sir. And you can always verify whether your transaction has gone through well by referring to your account through the website. So these are all the major safeguards that are available to us, sir. Therefore, I think in today's context, it will be difficult to live without using all these things. But let us use that with caution. Let us use that with certain amount of, maximum value, etc. So up to 1,000 rupees or 2,000 rupees, I will do all those things. More than that means I'll better go personally and do that. So that kind of a thing you can do. Therefore, even if there is going to be a loss, the loss may not be much. So it is like having a, having a ambulance on the highway. You do not-
SMS is coming when you present a check to anybody, whether we can honor. The cautious messages are coming from bank, whether we can pass.
Exactly.
Because there are some good facilities are also there. We have to be conscious. We have to be conscious. Then next person we can give.
So
Thank
if
you.
we can,
Thank you, Doctor. Thank you, Mr. Jamunathan, for your valuable comments and views.
So I would like to pitch in for a while before we move on to the next participant. So I think so Tanga sir has brought some good points here. One, he mentioned about this use of teleconsultancy. Now, this we had seen practically during my MD course here. That was the second and third year was during the COVID crisis, and it was sort of a havoc or a crisis with respect to our patients because they couldn't come, they couldn't access medications or get a prescription. A lot of patients had unfortunately relapsed or were on the verge of relapsing. So at that point, we had extensively used this, our telepsychiatry portal or platform to reach out to the patients. So we had done both. Wherever feasible, we had taken teleconsultations, sending a link who were able to join in that, or we had sat and picked up their phone numbers from the files and called them up to see what we can do. So as and when needed, we have scanned the prescription and sent them a mail because we are using psychotropics. The prescription needs to be updated. Otherwise, you cannot avail the medications. Now there we were able to, appreciate. Now this was always there. Telepsychiatry or the consultation was nothing new, but we could understand how much it helped us, sort of contain the situation or help us get through the COVID crisis with respect to our patients. That was one point. And yes, second thing what he mentioned was at an administrative level, of course, a lot of changes are needed. It's a choice. You can make it better and make it very beneficial, make it very user friendly to our people. Again, but have a check on what are all the limitations and be a little sensitive or very mindful to that. It should not be generalized. Right. So a regular audit or surveys has to happen, like how much this is actually helping our population, and sort of do a little sub-analysis maybe in which age group, what is more relevant and how much it is being used, what are the usual challenges in, let's say, midlife or a little crossing 60. Now, this has to happen at an administrative level going forward. And again, the human interface cannot be totally replaced, right? So our mind, the complexity of our mind, our experience or knowledge about the particular task, like how Jamunathan sir mentioned, it is our call. It is our discretion to make a call, like how much risk am I going to take in using these apps and transactions, where I will choose to, actually, I don't mind taking up a day and going to the bank in person. That was an example, right? Because the way it is being handled in a bank in person, how you clarify everything, again, 70-80% can be covered. There is a column for frequently asked questions in generally, but it is not totally replaceable, right? Artificial intelligence again is not going to completely replace human interaction. So it does make our life easy in many ways, but it is our discretion to see where it ends, to have a set of, boundary where we stop. So that was one point that you brought up. Yeah, we can continue. Anyone else would like to share? Please go ahead.
Technology is manned by a man. People. Technology can't work with it without the help of a person.
Right. So there was one saying which
has mind to solve positively. That is my view. I am not finding fault with anybody.
Yeah,
Every
sir.
technology is manned by a person competent.
So, so I would like to quote one of my favorite sayings. So, who will guard the guards? So basically, yes, like you said, there is checkpoint. It's not like it's handling on its own, right? It is done by people. It is executed by people, of course. But how well are they getting the feedback and sort of making suitable changes? How user friendly? Basically, it has to be user friendly. Now there it is not age dependent, like it is for all of us, how comfortable we are. And so that have to be done in a very mindful way or in a very, sensible way. That was my point.
Well said, doctor. Well said.
Thank you, doctor.
Any other person, some other person wanted to talk, tell something.
It could be a personal experience, like how it has evolved in the last 1-2 decades, and subjectively how you feel about it. Like I have my own thoughts. Even I started with a small Nokia phone, and now I'm using an iPhone in the last 1 decade. So everybody, all of us have, changed, and
We have all upgraded, doctor. Not changed only. We have all upgraded ourselves.
That way we say there were times. If that way you say there were times when we used to book trunk call and wait in post office for about 2 hours to get through that call.
Exactly.
I mean,
yes, sir.
telephone at normal online landline telephone itself was a luxury. If you apply it, it used to take 3 years or 4 years to get sanctioned. So now you're sitting at your bedroom, you can talk to states, London, anywhere you can just ring and you can talk. That's how technology has evolved in the last few decades.
Very true, sir. Very true.
Technology has evolved, doctor. No doubt about it. And doctor, I tell you, again and again, my only emphasis is that, see, this is something available to us. We need to harness it, use it for the benefit of us, all of us. And we benefit of us.
Excuse me, Mr. Yamunathan. Is the cryptocurrency going to come here?
Sir?
Cryptocurrency. What about the cryptocurrency that is?
Sir, that's a very, very big topic, sir.
Sorry, it's IT out of place, probably.
Talk about it separately, sir. It's a very big
Okay. Sorry for having this out of place.
Technology has to come. Technology has to come into your life. There is no option for you.
Exactly.
Further, as this artificial intelligence, how it is going to change the world, maybe within another 5 years, there may not be even mobile phone also. Mobile phone also may go off.
Exactly.
Artificial intelligence is coming. It is going to play havoc. I don't know whether it is good for good or bad. It is going to play real. Life is going to change a lot.
There is going to be a complete disruption, sir. See, in fact, we have seen complete disruptions in so many other fields also, sir. See, do you remember, the telex machine? Do you remember that machine even, telex? Once upon a time, telex was ruling the roast. Once upon a time, telephone was ruling the roast. Today, in 90% of the houses, the landline phone has gone out.
Yes, BSNL is no more in the picture.
So there is going to be complete disruption, sir.
Yeah, that's artificial intelligence is going to play really that kind of thing. Maybe within another 5 years, I think totally it is going to play. Already the way.
I am told the doctors are going to be
one request, doctor. One request.
Yes,
Whether online appointments are available in NIMHANS, because there be people far away, they have to attend 8 a.m. and get tokens and allotted some doctors for evaluation. Whether the caretaker and the patient both has to come to Bangalore for treatment or consultation. Whether online appointment is feasible in NIMHANS. for senior citizens. Like that.
Sir, I can respond to it before doctor responds. I have myself personally booked an online appointment with the NIMHANS. Not the online appointment as such. You are getting an online token.
Oh,
You are going to pay 20 rupees fees and get an online token. And on that online token, you can go at the appointed time and then you go to the doctor. This is the only thing, to my knowledge, happens because
Yes,
I have myself done that.
To answer the second question, if it is an index visit, so if it is going to be a first visit, yes, it has to, ideally happen with the patient. Unless otherwise, some other extreme situations where the person is very uncooperative or physically quite ill, markedly ill, where they cannot show up. At that point of time, the caregiver can come and, give us the history, and we would formulate a plan and see the patient in subsequent follow-ups. That can be done, especially in our geriatric team. But ideally, yes, best way is for the patient to show up. Yes.
But doctor, in this COVID time, there have been teleconsultations also, no?
Yes, sir. That's what I was saying. It practically saved a lot of patients. Given that, we are dealing with psychiatric illnesses and people, most conditions maintain with one or the other medications ongoing. Let's say suddenly because of lockdown, they couldn't come. So it's a vast majority of our patients are below poverty line. They come once in 3 months to get the medications and go from various parts. So suddenly that stopped and they had no medication. Some even managed with half the dosing for, let's say, a few more weeks and managed. Nonetheless, at least 60-70%, were on the verge of relapse. Few actually relapsed and they had to bring them to the emergency. So teleconsultation sort of saved the entire system. So we were able to, scan the prescriptions and send it across and sort of coordinate with one or two pharmacies there. So yeah, like I could appreciate the value of this teleconsultation overall in those 1.5 years during the COVID crisis. Yeah, that was my personal experience.
In future, video consultation will be available in future.
It is still there, sir. What happens is, see, a teleconsultation, be it a video call, the option is there. We have a specific set of consent and the protocol that is happening.
The caregiver should have the Android phones facilities.
Yeah, that is one challenge, and they have to be a bit comfortable. And many times what happens,
because
it is more reassuring for them to come in person to meet the doctor, sit in a clinic, and so many prefer that. But like you said, few people who are coming quite far away, like they prefer an online follow-up once in 4 months or 6 months. In them. But many in our situation, we see they want to come in person as much as possible.
As you said, below poverty line, they cannot consult local doctors by paying heavy fees and other things, medicines like that.
Right, sir.
They are approaching only NIMHANS for free some experts, professors and other things. They are able to get services.
No, the
That's
quality
one reason.
better. The quality.
That's one reason.
Yeah,
Quality. Everybody wants to meet NIMHANS only because they are having more faith with NIMHANS, neurology and psychiatrist. Both departments are functioning well as an all-Indian institute. People are very, very much interested in attending NIMHANS. But journey, cost, waiting and other things, they have to bear all these things. In that case also, some middle and rich people are getting services. The poor people, like video conferences, they have to first, in due courses, because it will be very, very, technology will be used in that way also. Thank you, Doctor.
Yes, sir.
Thank you, Doctor, and thank you, Mr. Jamunathan, for having given an interesting evening.
Thank you, sir.
Thank you. Thank you.
Thank you.
Thank you, Dr. Thank you, Jamunathan, for enlightening us.
Thank you, sir. Thank you. It is our pleasure, sir. So any other person likes to make any other point, sir? Because doctor is very keen in knowing something from us.
Sir, thank you, Doctor. Thank you, sir, Mr. Jamunan, sir. And
சொல்லுங்க.
Mr. Nagaraj. Regarding the transactions, we know, we came to know much precaution, the measures we have to take. Thank you, sir. Once again, I thank you, sir.
Thank you. Thank you, ma'am.
Yeah, so thank you all. Again, take home message. I don't want to get all technical. So pros and cons, we have to be aware of, and always it has to be our discretion where we put a line, and be mindful about our usage, all this social media apps, right? It should not be detrimental somewhere to our, excessive screen time is also not good. So we get engrossed and, in our online platform sometimes for entertainment, it goes on and on. Now, this is not very age relevant, but again, post-retirement, like just as a time filler, or it is more stimulating, so we end up continuing watching for hours together without even being aware of it. Now, that is where we have to be a bit mindful that it is serving me a purpose. Yes, I like it, I enjoy it. I learn a lot probably, but when to sort of take breaks and be mindful about my usage. So again, balance, strike a balance and sort of ensure safety for our money or time, and use it very appropriately as and when needed. Now, overall, this I feel would be, the take home message.
Thank you, doctor, for a beautiful take home message.
Namaste.
Yeah, so it's actually, it is that. See, it is ultimately, we need to be mindful about our time. We need to be mindful about our money. Therefore, it is very essential. And, doctor, you have very correctly stated that some people are addicted to certain instruments. So let us not get into that addiction mode. See, that's one, very difficult situation, and people get addicted without even knowing. That is again the second point. Therefore, I think that's why I say that once in 15 minutes or 20 minutes, just walk for a few minutes and then come back and sit. So like that, they say, sir. So I think if no other person is there, we can just, I can thank Dr. Ramya Varadarajan for MD. Sorry, I did not mention your MD qualification. I think the reason is that I was more into this, Stanley.
No worries, sir. No worries. Yeah, I did my MD psychiatry here in NIMHANS.
Sir, Jamunathan, sir, addiction is not going to jump over you. Addiction is going to creep. It is not going to jump 1 day or 2 days. It is going to creep.
Yeah, that's a valid point. Yes.
You never